Have you ever wondered what bad cholesterol is? Well, stay tuned because on CVTV, you're about to learn. I'm with Dr. John Osborne. Great to see you, John.
Good morning, Scott.
What is bad cholesterol?
So bad cholesterol is the stuff that lodges in our blood vessels and begins that whole process of plaque formation.
All right, so if I want to know, I'm a patient watching CVTV, and I want to know if I have bad cholesterol and when I need to do something about it. So do I have bad cholesterol in my body?
Well, we'd have to check.
Okay. What's the medical name for bad cholesterol?
We call it LDL, or low-density lipoprotein.
Okay. So do I have LDL in my body?
Everybody has LDL.
Oh, so I do have it, but it only becomes bad if it's too high.
That's correct.
Okay. So how do I figure out how much LDL I have in my body?
We need to check.
And how do we do that?
Here at Save the Heart, we actually have simple technologies. We can take a drop of blood, and in 5 minutes, we can check your total cholesterol, your LDL, or we call it the LDL starts with an L, so we also call it lousy or lethal cholesterol, because you want the lousy or lethal cholesterol low.
Or we can draw a blood stick and actually send it off to the lab. Is that correct?
Do that too.
All right. So now you're going to get a number. That's called LDL-C, right? Or calculated cholesterol, LDL cholesterol. What's a good number? What's a bad number?
Well, there's a spectrum. The higher that is, the higher the risk. The lower that is, the lower the risk.
Okay.
To put that in perspective, when we're born, our LDL cholesterol is about 40.
Okay. And if I lived in Sahara Desert, or I lived out in Africa where I'm doing a lot of physical work, or Asia, or South America, or the farmland of the United States, what would my LDL be?
Your LDL in those kind of scenarios would be about 70.
70. And so when does LDL start to dive into the wall of my blood vessel and kill me?
The higher it is, the higher that risk.
Aha. So if it's above 70, does that mean it might be really diving into my blood vessels and starting the problem?
Yes. In fact, we know if you have people who have plaque and we drive it below 70, that substantially lowers the risk of recurrent strokes and heart attacks.
So is LDL-C the best way to measure bad cholesterol?
There are a couple different ways. Probably the best way is to use an even newer technique called LDL-P.
P instead of C. What does the LDL-P mean?
What we do is we go beyond just measuring the total mass or weight of LDL cholesterol in the blood, and instead we take a more sophisticated analysis where we actually look at the particles and we count the number of particles, because cholesterol comes in particles that float around in our bloodstream.
And so the chance of me having a heart attack, it's not just about how much I have in it, but the number of particles within that amount of LDL.
That's correct.
And so what's a good LDL-P number?
Well, ideally, less than 1,000 is quite good.
Is that a real expensive test?
It's really fairly inexpensive, and it's been well validated in the scientific literature to show further value beyond just understanding your LDL-C.
So when you get an LDL-C and it's high, do you then check sometimes the LDL-P to see, okay, I know I've got a certain amount of LDL, but how really bad is that LDL in the body?
We do, particularly people where there's a really strong family history of heart disease early on, where we go, the LDL looks a little high, but we really need to understand, is it really bad or not? Or people who've had heart disease, where we really need to understand and aggressively treat it and make sure that not just the LDL-C is good, but the LDL-P, or particle count, is also excellent.
Are there any other clues that the P and the C may not be in balance, like, say, for instance, sugar levels in the blood, or good cholesterol, things like that could help?
There's a whole number of things that also, they're kind of conspirators that play a role, and other signals that give us an idea that you could have high LDL-P when your LDL-C looks okay.
So if my triglycerides are greater than what, should I be worried about my C and P not being?
Frankly, if your triglycerides, which are one of those cholesterol fat things we measure with that finger stick, are greater than 100, you could have high levels of LDL-P, or particle.
What about HDL, or good cholesterol? When would I start to worry about it with that?
And anytime your HDL cholesterol is less than 60, it puts you at higher risk for having more of these LDL-P, or high LDL particle counts.
What about, say, for instance, blood sugar? Does blood sugar relate to that?
No question. For people with abnormal blood sugars, even before you develop frank diabetes, your LDL particle counts also can be markedly elevated, even in the setting of what looks like a normal LDL-C or LDL cholesterol.
Okay, so got bad cholesterol. It's LDL, whether P or C, it's going through our blood. The higher it is, the more likely we are to develop plaque. The lower it is, the better off we are. What do we do to get it down?
Well, let me say, too, Scott, we talked about where we start out. We start out with LDLs of 40 when we're born. I call that a neonatal LDL.
Okay.
And while I'm an adult cardiologist, I don't know anything about kids. Okay, that's not my domain, except two things. One, we're born with LDLs of 40, and at an LDL 40 when we're born, we don't have plaque. Plaque is an acquired disease. We build it up over years. The more LDL cholesterol we have, amongst other things, the greater we feed that plaque. By the time we're adults, our LDLs go from 40 when we're born to an average LDL in the United States of 130.
Wow, so 3 times, 4 times as high.
Right.
So is 130 going to be enough to push that cholesterol into the blood vessel wall and have me get that heart stroke?
Well, also have to understand, Scott, in the United States, as we walk around as a population with average LDLs of 130 as adults, 50% of us die of cardiovascular disease. So while 130 is average, I don't believe it's normal.
Yeah.
Unless you want to face a 50-50 chance of dying of plaque.
I don't want to, so I want it to be perfect. I don't want plaque to develop. What do I need to do?
If we want to be the average American, walk around with an average LDL of 130, then we'll probably have that average stroke, that average heart attack.
Oh, great. So what if I want to be better than average?
You want to get that LDL cholesterol and the LDL particle count down.
And how does one do that?
Diet and exercise are going to be the first strategies, and we're very aggressive about really pushing and aggressively going after diet and exercise and non-pharmacologic therapies, as we always should. I think there's tremendous benefits. We have a variety of programs we work with, including TLC Edge, that allow our patients to be able to achieve assistance in helping us to maximize as much as possible the role of non-pharmacologic therapies to really improve those numbers as much as possible.
Okay, so to make this real for those who are watching CVTV, what you're saying is that if you eat things that have bad fat in them, your bad cholesterol, LDL, goes up. If you lower the bad fat containing foods, the LDL cholesterol go down. Is that what, is that?
Yes, but about 80 to 90% of that LDL cholesterol is dependent upon your genes, which is dependent upon your mom and dad.
Okay. So I only have 20% effect on it. So if my LDL is 130, then, and I change the way I eat, the best I can do is get that LDL down to 116, 114?
Approximately.
Okay, and is that enough of a difference to matter?
If we hope to reverse plaque, we really need to ideally get that LDL probably less than 70.
And an LDLP less than?
1,000.
Okay. So what about exercise? How much can I get the LDL, bad LDL, down with exercise?
Again, with diet and exercise, non-pharmacologic therapies, it is effective, but the effects are modest.
Okay, so I need to do something more than that. What's the next step?
Many people do, and we do have tools that are very simple, very effective tools, where we can basically turn off that molecular faucet that in certain people, they're just overproducing cholesterol. Our body is very effective making cholesterol. It's not good at disposing of cholesterol.
So what is that?
The most typical drugs we use when we need drugs to further lower those cholesterols are drugs called statins.
Okay, what's some names of some statins?
Crestor, Zocor, Lipitor, Pravachol, Mevacor. Those are the most typically used drugs to lower cholesterol.
So to tie this all up and put it in a bow, what bad cholesterol is called?
LDL.
And you can measure it in terms of just how much you have, and that's called?
LDL-C.
Or you can say how many particles do I have attacking my blood vessel?
That's LDL-P.
And when we're born, it's 40, 70 is normal, average Americans 130 and the LDL-C. And if you have a normal LDL-C, you have a heart attack how often?
About 50% of the time.
And so that's probably not good. So we probably want to get that down. The way to get that down is to choose our foods carefully and to be active. The other thing that we can do is take certain medications such as?
Statins.
Statins are a good example. All right, I now feel like those of us who are watching this will really understand that. So thank you, Dr. Osborne, for being with us as we explored bad cholesterol.
Thank you, Scott.
And thank you for being here on CVTV.